So disadvantages of a smile design or digital smile design. What are the disadvantages? Because we have been in our previous video speaking about lot about veneers, smile design and everything. What are some of the disadvantages? We will be looking in this video. Again, this question was asked by one of the viewers in the comment section below. This video is in specific response to that. This is Dr. Arun from Pearls Dentistry, running at dental centers at Chennai, Raja and Amalapuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel. We are coming out with a new video every day. So now let's look at some of the disadvantages that are there. So first is, what we should understand is when it comes to smile design or digital smile design, we are doing a cosmetic procedure. So any cosmetic procedure will be successful only when the patient and the doctor is in complete understanding of the need and the requirement that is there. So first, the patient should be able to clearly communicate what the patient wants. What is it that the patient doesn't like about their teeth or the smile, and what is the end result that is going to be represented. And the doctor has to understand that requirement well. Once the doctor understands that requirement well, and the doctor has to do a mock build-up or a duplicate of how the teeth is going to look or the smile is going to look post the treatment, and should be able to tell to this patient. So because what we need to understand is, because there is a patient, the doctor, and sometimes a lab is also involved, and of course there is a digital interface for all these things. Because there are 4 different elements involved, there has to be a complete coordination and communication between all the people involved for the digital smile design to work well. If there is lack of coordination or lack of communication, the results might not be as good as it is as the computer shows. This is one main disadvantage what is there. Second is, what we should understand is, because it's a cosmetic procedure is always used to mask an underlying problem that is there either in the patient's teeth or in the patient's gums, lips or the bone. So because it is used to mask an underlying defect that is always there, there is only certain amount of work that can be done to mask it. Because certain things which is surgically has to be done. We won't be able to cosmetically mask a bone that needs to be surgically corrected. So when it comes to masking underlying problem that is there, what we should understand is, some of the cosmetic procedure, for example, the tooth is discolored, can we mask it? Excellent masking. The tooth is little not in proportion, can we correct it? We can correct it excellently. But say the tooth is crowded, can we completely correct it cosmetically? To an extent it's possible, because we need to alter the shape of the tooth, size of the tooth to correct it. So, or say the bone is completely out, can we mask it? Then it's not possible to mask it completely, because we might have to do more than one procedure to completely mask it. So what we should understand is, because it is used to correct it, an underlying problem, or used to mask it, we should understand what is possible and what is not possible. So this is the second disadvantage of, say, a smile design. The third thing is, say, when you do a veneers, or sometimes the patient might have some heavy bruxing force. So the doctor will advise the patient to wear a splint, the patient will not wear a splint. As rarely sometimes these tooth can break off or chip off, especially when it's a front teeth. When it breaks off or chips off, even though it's a rare occurrence, it's very, it puts a patient in a spot, because it will be in a difficult situation. It's your front teeth, right? It will be difficult for you to smile. You should be able to have access to a dentist immediately where you can get it corrected. So this is the third, even though a rare occurrence, laminates, veneers or front crowns can break. If it breaks, we should be able to go to the dentist to fix it immediately. So this is the third disadvantage. Of course, some people will ask, how many years will it last? It can last for many years. Only thing what we should understand is, it will last as long as our natural teeth are in good condition. So it's very important to take good care of our natural teeth. Visit a dentist once in 6 months to do a cleanup, because if you don't take good care of our natural teeth, if the gums are receding, the cosmetic procedure done will also have its own disadvantage, and it can start failing because of that. So these are some of the things which we should have it in mind before we plan our smile design, before we plan a cosmetic procedure. Hope you found this video helpful. If you have any questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.